Concord Hospital is a regional referral center. We primarily serve the markets in central New Hampshire. Full service, comprehensive services, including centers of excellence for orthopedic surgery, cardiovascular, women's and children's, as well as cancer care. Our journey with length of stay has been a concerted effort for about a year. We set forth a pretty audacious goal of a 10% reduction in length of stay within fiscal 24, which started in October of 2023. In year to date, we've achieved a 15% reduction in length of stay for inpatients, which has had a pretty profound impact on our revenue generating capacity, our overall savings, as well as our ability to backfill those beds with additional patients in our community. Wellsheet has been a good partner for our effort in reducing length of stay. Wellsheet is a novel platform that allows portability, use on a thin client, personal device in your pocket, also in a workstation, also embedded inside our Cerner application at the health system level. Its biggest impact has been the information available to the clinical team when they need it, when they're having a discussion, when they're discussing discharge barriers, when they're at our whiteboards, which is one of the pieces that we've really tried to optimize in the health system. People who are actually in the meeting can access the information. We are easily within our facility here able to admit 5 additional patients a day, which has helped us remove queuing, remove bottlenecks, and improve access. And I think the downstream financial consequences are also pretty consequential in that from a cost saving standpoint, this is millions and millions of dollars.
When we think about reduction in length of stay inside the hospital, we've developed a multidisciplinary team that uses Wellsheet to collaborate on patients who are ready to leave the hospital but may have some barriers to leaving the hospital. And so we're able to pull in physical therapy, the physicians providing care for the patient, care management, and other team members to discuss those patients. And Wellsheet has really served as a tool where we pull out pertinent information for the care of those patients and where we communicate our plan of care for those patients. Wellsheet has the ability to pull out the information we need to make actionable decisions on a daily basis. I feel that Wellsheet has been a really important tool for our clinical teams in the reduction of length of stay this year.
Our length of stay efforts have clearly borne fruit. Number one, it allows us to admit more patients into beds that are now available because of that optimized and shortened length of stay. And that, for our health system, is about a 10 to 12% opportunity to be able to backfill that bed with a patient who needs a bed. We've been able to actualize at the health system level a reduction in length of stay from almost 5.7 days down to 4.7 days year to date. Which is a 1-day reduction in length of stay for inpatients, which is a pretty dramatic improvement for the team.
Real-time notifications make a big difference for us, especially if we're thinking about efficiency. As a physician, being able to get information quickly and efficiently and find it all in one spot is paramount to making decisions quickly and getting the care that patients need done. One of the things that's really nice about Wellsheet is just the layout being very targeted, and the information you need is all sort of in one place. It's really helpful to have disease-specific tabs that give you all of the relevant vital statistics, the medications that were administered, and then like nursing assessments. So you can get all that information in one place and then make decisions on the spot. I think the faster that we are able to respond to patients' needs always improves quality. Not having to jump around from chart to chart or different views in our EMR, and just using one Wellsheet application to get the information we need means that I can make decisions quicker, I can see the patient sooner in the day and help make clinical decisions.
When I'm outside of the hospital, I'm confident that Wellsheet will provide me with all of the information I need to make actionable decisions. And that's through the rapid access to the medical record, but also through the real-time notifications of results. I'm able to then contact the necessary teams, and that leads to timely, efficient, and high-quality care. With Wellsheet, we're able to leverage the benefits of artificial intelligence without replacing the clinician experience. As a clinician, I can be confident that the data that Wellsheet pulls forward comes from the medical record. I can be confident that the actions I'm taking based on the data are evidence-based and in the best interest of the patient.